I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed. In this video, Aditi interviews Dr. Tanvi Parkar regarding the mindset needed when you make a shift from clinical dentistry into a non-clinical corporate job. If you're interested in making that shift, this is a video you should watch.
So, hi Dr. Tanvi, how are you?
I'm good, yeah. How are you doing?
I'm doing great too. So, I would like to introduce Dr. Tanvi. So, Dr. Tanvi is a dentist. She has done her BDS from GDC and she decided to shift to a corporate sector, and now she did her MHA from TIS Bombay, and now she's working in a healthcare insurance company. So, Dr. Tanvi, tell me, how was the shift from clinical to non-clinical was like for you?
So Aditi, first of all, thank you for having me here. It's a pleasure to be here. So if I have to talk about the shift from non clinical to non-clinical, it was definitely not an easy one, I would say. But actually deciding to do an MHA and then get a job, start working, it has its own set of challenges. The thing that is, I think, the most important decision that is difficult is basically, wanting to go from non clinical to non-clinical. So I think once you take that decision, that's like the most difficult part. And once you take that leap of faith, then everything else which is there is basically more of like, a challenge of the process itself. So that's, I think, the, one important thing that's there.
So, what are the problems that you face, like coming from an extremely bio background and shifting to the numbers? How is it like?
So the problems, I mean, there were little challenges. So as I said, the most important thing is basically to move from a clinical to a non-clinical field. Now, I had spent, I did my BDS from a government college, and then I actually spent 4 years, more than 4 years into clinical practice. And also, I worked in government hospitals, I worked in clinics and all. And but then, it was not working for me. I knew there were challenges that in opening up a clinic per se. So then the decision that to move into something or do something else now took a lot of thinking, lot of consideration, and there was a lot of apprehension and nervousness also. So that is like, I think, the most difficult step to take. Once you've decided that, with whatever, however, thoughts that you have, how many people you talk to, once you do that, then the other challenges was, one for me was, the second thing was, to think, okay, fine, I will move from clinical to non-clinical, but then what do I do? What is the non-clinical thing that I do? That research, that networking, that actually figuring that out. But that was like this, I think, the second challenge, hurdle that I had to cross. And once you do that, then I decided on doing an MSc. uh, then, the one reason that I became a doctor, like probably like most of us, was I did not like maths. Like I used to literally ratify the solved examples in the
Totally
textbook for 12th.
understood.
Yeah. So that was challenging. So there's a whole process that you have to give these entrances, and there are logical reasoning, there's maths, there's all of those subjects. So that, doing that, studying for that, and then actually sitting for interviews, and so all of those were a little some challenges that yeah, then the hurdles that you may face if you are going to choose move away from clinical. Yeah.
So, did you face any criticism from the society? Like you already spent more than, I guess, 10 years in into clinical practice. So, did you face any criticism? People telling you that why are you like shifting? You should just keep doing this or something like that.
Yeah. So, that criticism is always is going to be there. Okay, let's face it. Because, it's like, somebody else would have done it, you wasted a seat, अरे कोई और डॉक्टर बन जाता, ये इतना मेहनत
Right.
किया and अब ये नहीं करना है, ये क्या बात होती है. So that is there, and that mind you, that's gonna come from your closest people, right? It's not gonna come from random people. It's gonna come from your friends, your family members. कि डॉक्टर बन गई, अब ये क्यों करना है तुमको, and all of that.
So basically, they used to like say that अगर यही करना था, then why didn't you choose it?
Yeah, choose. Why did you do this? इतनी मेहनत क्यों की? But what do we tell them? And that is also one of the questions that you get in an interview, like when you're working out for your admissions or first or second of jobs. Why did you leave dentistry? Why did you leave dentistry? So that is also going to be there. Now, criticism for me, I think it's it's a given. It's going to be there. What is it is that how do you face this criticism,
How do you
how much
deal
you
with
let, yeah, and
Yeah,
how much you let it affect
thank
yourself, or
you. Right.
you get bothered, is the most important thing. So the one suggestion that I would like to give people out here is that if you are love clinical work, okay, and that's something which is your passion, बचपन का सपना है डॉक्टर बनने का, and that's what you have, which is for most of us, but you want to continue with that,
Right.
then uh, hold on to it. It will take time. I understand, there's been, a lot of the situation, the pandemic situation, a little less hands-on and everything. But if you are really passionate, then hold on to that. And if you're okay, like I was okay, I was very interested in analytics, data, projects, and all. So it
And
wasn't
we
that
as dental students are actually taught to deal with criticism in the college itself. Like
college
teachers
itself.
reject you
Yeah.
so many times for the denture,
Yeah.
anything. So we are
Anything.
used
Yes,
to the
yes, yes.
criticism. So this
So
seems quite less than what we have
what?
faced.
Yes, yes, yes. So that is absolutely there. And I'll tell you what, somewhere a mechanical engineer has opened a salon. Somewhere, a biomedical person is actually doing
Right.
psychology. And somebody
And there is
from
MBA Chai Wala also. There's this page on
yeah,
YouTube.
yeah, people have done MBA.
Right.
So it's okay. It's not that because being a doctor is like thought of as such a noble profession that you're moving out of it seems difficult for people to accept. But I think
Right.
it's okay. You
It's
if you
okay. At least you
yeah
are
if
doing two things and you have done something. You can
yeah
prescribe something on your own.
yeah, and you still keep on helping people everywhere, so that's something which is
Right.
going to happen. So criticism, try and deal with it, but make up your mind, like don't if you love clinical and if you move on to non-clinical, then the criticism will hit you somewhere very hard.
Right.
Don't let that happen, because time and efforts are going to be, you will need those in both ways, so
You will be
do
rewarded
what
in
you
the
feel.
end.
Yes, that's there.
So, what is the difference between the corporate sector and a clinical practice? Like, there are many struggles with the clinical practice as well, but what is the main difference between these two?
So there are differences and there are similarities also, if you think of it. So differences are very, one is that your clinic is your own space, okay? So there is a freedom of expression, freedom of creativity that you get, whereas when you're working into a corporate, you need to match your working styles with a lot of people that are around you. So that's one difference. However, both are equally difficult as well. So, here you have to manage a lot of projects or clients and all, and that's, similar to what you do with your patients as well.
Right.
Um, Another thing that is there is, the timing difference, the time difference, the way that you work is different. So you have to, this is basically usually a morning to evening job. It it depends on your projects if you have want to put in more or not. But if it's your own clinic, then You really need to be absolutely, managing it and, running it and everything. So the running costs, the running efforts are all yours as well. And there are a lot of similarities. So you deal with clients, you deal with people, you are solving their problems. Even in
End of
corporate,
the
you're
day,
solving their
it's like
problems.
running a business only. In clinic also,
It's
you
like,
run a
yes, yes,
yeah.
yes. In the clinic, you run a business, which is your business. In a corporate job,
It's a
you're still running a
cultivated
business, but it's
efforts
like,
from
yeah.
yeah.
So that's like, but it's more or less, similar
This.
to, the skills that you need probably are similar in both. You will need
So,
similar
what
skills
are
in
the
both.
exact skills that you will need in order to shift to a completely different thing and to a corporate sector? Like, which you
Um,
think clinicians don't really have?
Before you listen to the answer to that question, if you're liking this video, please do not forget to hit the like button below. And I'm sure you're subscribed to our channel because we help you take your career after BDS to the next level.
So the skills, so technical skills is one thing which, which of course you will need both when you're doing dentistry and when you're doing a corporate job or non-clinical thing. Um, so technical is one thing. I think the soft skills that you need are more or less similar to both of them. Okay. One thing is you need a lot of patience for both the jobs that you're doing. You need patience,
You
and
do.
I have learned it the hard way. Okay, in corporate, because I used to think कि क्या है मतलब desk के पीछे काम करना है laptop पे टक 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 टक. Why do you need? But you
You need
actually
a
do
lot of
need.
patience while you sitting with the burner and your tray and everything. You need a
Yeah,
lot of patience
lot
to
of
sit in the
patience.
lab also
Yes,
in the heat.
absolutely. And one thing is managing people, and actually listening to their problems and being empathizing towards them, even if you're not providing a solution to them. It's another common skill, but very important for both clinician and non-clinical work. And time management. So you could have like a flourishing practice with 20, 30 patients also in a day, but unless you're managing enrolling them, and giving them adequate time and still not making them wait for a long time in your waiting area is absolutely important in a clinical practice. And managing like 10 different clients, and then you actually dealing with them, and most of the time, a lot of times they're pretty irate also. You need to deal with them as well. So that time management and people management is one skill I think both of you
So, what do
require.
you think a final year student or someone who is studying dentistry should learn at a student level in order to like do a little better in the future?
Um, so again, one thing that from my learning is probably I could have done better is networking. You know, what has happened is
Your
back in
network
the
is your
day,
net worth.
your network is your net. Absolutely. So back in my day, like I'm not that old also, but still, 10, 12 years back, it was like, एक like तुम doctor बनते हो, engineer बनते हो. That two things. Now the thing that was bad as it was. Now what I feel has happened is, there are so many opportunities that a lot of them you to decide where you really want to go is also very difficult now. So
Right.
lesser the options was also difficult, too many options is also becoming difficult. So the more you speak with people, the more
The more you
you,
are confused, actually.
yeah, the more you're confused, but you get a lot of different perspectives.
Of
So
course, of
you
course.
don't have to take everything, every word that everybody is
So, end of the day,
saying.
it's your choice only. But I think with too much of knowledge comes too much of confusion as well. So it's like no knowledge, no confusion, and then too much of knowledge.
Too much knowledge, too much confusion. But you
Right.
can then you can actually sit and take a notebook and pen and write. Probably use the pros and cons method to actually
Right.
funnel your options. So out of
Right.
100, now you can because you've spoken with people, what their experience have been, and you can come down to 10. So I think 100, 10 is better than 100 options. So that is something, when you speak with people, clinical, non-clinical, ask their experience, understand from them, how their journey has been, helps you a bit more in, maneuvering your own path
Right.
in life.
So,
So
what do you
that's
suggest? Someone should go for MDS or someone should go for MHA or MBA?
no. So MDS and MHM is absolute. Again, MDS, if you want to do, if you are in love with clinical practice, that's something which you really want to, follow for the rest of your life or for a longer time, and that's where you'll see yourself. And that's the work that you see yourself doing, and you can't think about, imagine yourself doing like a desk job or meeting clients and doing the rote corporate job, or then definitely MDS will work. Again, there are different schools of thought. Some people say, okay, you instead of doing an MDS, you open up your clinic so that that's you spend that time in building up your patients,
So,
and then
does
you
a
can
good
keep doing
hand
courses.
skill matters in dentistry? Like a lot of people really want to shift to MHA because they don't really know if they have good hand skills. Like we do how what is this trick to know that you have a good hand in dentistry?
So, so that's a very good point, and there are a lot of people who are actually doing MHA also, and who have just passed out. Some of them, do just give you a call and they ask you, "Hey, what to do,"
Right.
and like I'm not the best person to really tell you, but this would be my general suggestion to everybody is try working for some time post you graduate, okay, into the
Okay.
clinical field. Only then will you know if you have it, what it takes, okay, and if your heart lies in. And I mean, see, we're talking about mindset. We're talking about corporate. Is corporate better? Nothing is better. Nothing is like
Right.
a flowery picture. Nothing is a rule. Everything has its own efforts. Everything takes time. Uh, you know, uh, it's not that you move to non-clinical, it will start raining money. Nothing happens like that. Does not happen. So you work for some time. You see if you really like it. If is your heart there, and are you okay? It doesn't work for you, but are you still okay moving out of it, or you still okay putting in some more time there? So that's something that you take. If you feel that you can do that, then go for an MDS or do a course, and continue with your clinical. If you're okay with doing something else, then you can think of shifting to something else.
Okay, so this is a little tricky question. So, what do you think us as students have a myth which is not really a myth? It is true.
Uh,
A myth that you believed in actually, but it was like, no, it's not.
the last statement that I made in a previous
Right.
question, it's not going to rain
In
money.
money.
If you think so for me, opening a clinic was something which the reason that I didn't do that was because I couldn't afford it. To be
Right.
bluntly honest, I could not afford it. It takes a lot of investment, it takes infrastructure, it takes a running cost, and there was a lot of competition at the time. It's still there, so that's the reason I decided to move. But I thought, yeah, I'll move and then I'll probably do so much good in my life. Doesn't happen. Everything takes time, the same amount of time, if not more or less. And the other thing, one thing that I again learned in my this thing is, do not compare yourself, your career path with others. It made me feel very sometimes depressed because one month we are doing a medical dental course that
Right.
is already 1 year longer than the general engineering and other courses.
Right. Right.
So you're
Totally.
already 1 year behind from your peers.
And
And
you
then
see everyone graduating, getting
on a
money, posting
job,
online,
yeah,
traveling the
and
world.
going on vacations and
Yeah.
chilling on weekends, and you're like, what am I doing? But I think eventually everybody comes at par, like after a certain thing. But yeah, you need to just be patient and decide for you, how it works for you. Else it will be good.
So, what is the biggest lesson that you have learned, like from switching from clinical to non-clinical, and in life in general? What is the biggest learning that you feel? Yeah, this is what I've learned from life.
Okay, I guess I'm not like, probably not like the best person giving advices through my life journey
This
and
is
all.
not an advice. It's just like how you have learned things in the past few years, like what you
So,
thought would be like and what is it now, that way.
so two things, okay. And again, I'm going to use some cliche lines from these a book and a movie probably that I read. So one thing, and again, I learned it the hard way. I mean, I would have been thankful for something like this happening, at the time. But so one thing is that, experience is one thing that you get when you don't get what you want. So, you think that, okay, yeah, did I really waste these 4 or 5 years of my life? Did I take the right step? But it's all a part of a larger experience, and whatever you've
Right.
learned, never goes waste. So there was
Based.
this one
Right.
interview of this comedian Zakir Khan, and he
Right.
was saying that his parents forced him to learn sitar or some musical instrument, and that time he used to be very irritated कि why are they making me, forcing me to learn this. But he said a very beautiful statement that, कल को अगर मेरा एक हाथ शो नहीं चला, so I know probably I can teach sitar to children and
True. True.
make money. So कल को even if you do change to non-clinical, go to corporate, you lose your job, you do anything, you can
Then also you can come
actually,
back to clinical
you have
practice.
a skill, you all have a skill,
Right. You own it.
and you own it, and you can nowadays you can be a blogger, you can be a
Yeah,
content
totally.
writer, you can be have a podcast of your own, and which is dentistry related, so that
Right.
is not going waste. So
So
that's
Sadhguru
something.
also once said this, like he blesses students and people, saying that may you do not get what you want. May you get
Yeah.
something out of your imagination that you never even thought of you would get. So I
Oh,
think expectations really hurt when you kind of assume your life will be in a certain way, but it doesn't really turn out to be in a certain way. Like us as students experience it in everyday life that a patient says that he will turn up, but again he ditches because of rain or so for some other reason.
yeah,
So we face it every day. So I think life should not be assumed and you should not really have expectations. You should just go with the flow.
absolutely, that's one thing. And the second thing that I actually learned, I mean, this again a cliche line I heard in a movie, uh, which is, don't recognize failure, and failure is just, there's nothing as failure, there are only setbacks. And when you look at it, like there was a time when I for some reason after doing my masters in hospital administration didn't want to work in hospital, like one weirdo in college. So I was looking at IT or insurance, and there were very few companies who would come for placement. And then finally kuch push, and I got into an insurance company. And that was a nightmare because the culture of the company matters, and to top it off, my manager wasn't that great and all. So at one point after more than a year I had it, okay, and I quit my job.
And you're
And
not even used to that behavior, right? We were
you're
living
not
independently, yeah,
you're
in college.
not so you learn a lot in corporate. It's way different, and you have to have that. And again, that's where I learned it, that it's not them, it's me who needs to become more
Right.
resilient to whatever feedback I'm getting. So that point I had quit. I had no job, and I whatever offers that I was getting was like, oh, because you don't have any job, we will not give you enough money, even what you were making so far. And I was like, what did I just do? Like, I spent such long time getting out, because I could was not making enough money, and I'm back to square one. And like, I hit rock bottom. But then, I think eventually God has different plans for you, and you just keep
You
looking
just have
out.
to trust the process.
Yes, and then it didn't. It worked out. There was a setback, and then it worked out. So those, like, some couple of my life lessons probably, which I hope help someone.
So, what would you advise to a final year student or someone who is pursuing dentistry and is, confused between what to do?
I would say, as I said earlier, also give it some time and work. Like, work for a year at least while you're. See, even if you're working, if you're going to join a clinic, as an associate or as observing and all, you will still have time to figure stuff out, or look around, because clinics, you still get 3 or 4 hours in the day to really, excuse me, do your research and everything, if you want to move out or no. But try to understand whether you belong in the clinical thing. So work for a year at least post your internship, and choose a good clinic also. Like, that is also important. So it may be a little far off from your place, or but that should be something which, where you get to learn. Because I have learned, and I'm sure Dr. Satish will back me up here, we both started off working with this great place. And so we not just learned clinical there. Okay, you learn how to manage an entire setup, and that is important. And I think that also helped me throughout. Like, even now I can, that management of particular situation and people, time, is something which I learned back then. So those are again some experiences which you get, and you should really cherish them. So work for some
Do
time.
you
It's
think the job structures and the kind of jobs will change for dentists in within a span of 10 years? Like there are a lot of dentists who have started practicing cosmetic dentistry, and there are a lot of dentists who are into nutrition. So do you think the kind of jobs will also change for dentists in the coming 10 years?
I do think that it's not about the jobs per se, but there will be more openings. So with the the social media, and the advent of virtual worlds and everything, a lot, or artificial intelligence and all of that, as a dentist, if you don't want to do clinical, you don't necessarily have to join a corporate. You can write content. You can become a consultant, say, for a medical devices company. You can become, you can, as I said, you can write your content. You can create a podcast. You can help an AI company to build a software. Where there's virtual diagnosis.
Right.
So now the thing is, now the options are so many. Also,
Options.
there are a lot of certifications and fellowships that have come up,
Right.
so that also, I think, helps somewhere, to enhance your skill set, your knowledge, and then be there and do something else also, not just typical. So it's not no more, I think, that if you're a dentist, you need to open a clinic, otherwise you can't do anything. That's not there. Or you need to join corporate. Nothing. There are a lot of avenues. Like I said, you need to speak with people. You need to connect with a lot
You
of people
belong to.
and find that one thing where you can find your place. So that's important. Yeah.
So that's it from my side. If from the audience anyone has any questions for Dr. Tanvi, you can write it in the comment section below so that she answers. So we'll wrap up this session.
Thank you so much, Aditi.
I really I'm very glad to be hearing this from you, because as students we have a lot of things in our head, like we see our parents working who do not work, like it's like the grass is always greener on the other side, right? So we always feel that this was more easier, and as dentists we also feel that we should have done engineering. It is a 4-year course, people get placed also easily. You do it from any college or whatever you do, how much you fees you pay, you get something in the end.
No, I
That
think
way.
you should then speak with the newly passing out engineers also. It's they have facing similar challenges, especially because the institutes are a lot. There are a lot of institutes now as they were before, and there are a lot of, again, lot of engineers coming out. And how many placements can people, you have to really figure that out, and you have to get into a premier institute where companies are lining up. So yeah, I am from TIS, but MHITIS may not really have all the time 100% of placements. You really
People
need
go
to
outside
invite.
also to pursue this course. They go to abroad also to pursue the same course.
Yeah, yes, there are those options also. But again, I think, going abroad and doing something has its own set of other different
So that is
challenges.
completely different along with a complete different course.
Yeah,
I think
yeah, yeah.
it's like crying in India is better than crying abroad.
Crying abroad, yeah. But the opportunities are also there. Good opportunities are also there. So yeah, so it's again, I know of friends who doing very well. But again, then you need to have that mindset to, that because probably you will not be able to come back and work here.
Right.
I'm not sure of that, but yeah, if you really want to stay there and pursue and maybe build a career there and all, I think those options are also something that people can look at.
Okay. So thank you, Dr. Tanvi, for joining us. I'll be ending the live session. And thank you so much for the
Thank you for
wonderful.
having me. All pleasure is mine. Yeah. Thank you so
Okay.
much,
Thank you. Bye
Aditi.
bye.